Welcome to this explainer. Look, if you're an adult and you're wondering if ADHD might actually explain your daily struggles with focus or, just general organization, finding an answer can feel like a massive, confusing maze, especially here in California. So today, we're clearing away all that confusion. We're using a comprehensive guide from Elevate Health Group to map out exactly how this testing process works, what it costs, and, realistically, how long it takes. Okay, let's dive into this roadmap. We're going to cover 1. The big ADHD testing myth. 2. The 5-step assessment process. 3. Breaking down the costs. 4. Your timeline to answers. And 5. Taking the next step. Section 1. The big ADHD testing myth. So before you even pick up the phone to schedule an appointment, there's this major mental hurdle. Who actually tests adults for ADHD? It's the first real friction point, right? You finally decide to seek help, and suddenly you're paralyzed by this assumption that you need to track down some highly specific, super rare specialist. It creates a ton of anxiety, and honestly, it stops a lot of people right in their tracks before they even begin. And this brilliantly illustrates exactly where that confusion comes from. The myth, the thing everyone kind of just assumes, is that adult ADHD testing strictly requires a psychiatrist or a specialized neuropsychologist. People think, great, I have to get on a waiting list for months just to be seen by a niche expert. But the reality? In California, primary care and internal medicine physicians are fully qualified to evaluate, diagnose, and treat adult ADHD. For instance, the board-certified internal medicine team at Elevate Health Group does this evaluation directly, just as part of routine primary care. I really want to pause on this exact quote from the source material because it's incredibly empowering. It says, "You do not need a specialist referral or a months-long wait to get answers." By removing that imaginary gatekeeper of the specialized neuropsychologist, the path to understanding your own brain becomes so much faster, and honestly, so much more accessible. You don't have to wait half a year. You can start right in a primary care setting. Section 2, the 5-step assessment process. Let's move to and see how this builds. Now that we know who to see, let's demystify what actually happens when you get there. It's not some mysterious, opaque process. It happens in 5 really clear steps: the initial visit, standardized questionnaires, a history review, medical rule-outs, and finally, the diagnosis and plan. You and your provider are going to walk hand in hand through each of these phases. During step 1, that initial visit, you basically just describe your symptoms, when they started, and most importantly, how they're actually affecting your work, your relationships, and your daily tasks. Moving into step 2, we get to the standardized questionnaires. This is fascinating because it's where your subjective daily struggles are essentially transformed into objective medical data. You'll complete validated ADHD symptom scales. And these aren't just, random online quizzes. They are clinical tools designed to specifically quantify the exact levels of inattention, hyperactivity, and impulsivity that you're experiencing. It gives the doctor a solid, measurable baseline. After reviewing your childhood and family history in step 3, the doctor moves to step 4, which is absolutely crucial: medical rule-outs. Because actually, scratch that, it's more like realizing that not everything that looks like ADHD is ADHD. Your provider will do blood work or a physical review to ensure you aren't dealing with other conditions that just mimic those symptoms. Things like thyroid disorders or sleep apnea, which can cause severe brain fog and fatigue. This really highlights the medical thoroughness of having this done by an internal medicine physician. They look at your whole body health before moving to step 5, which is finalizing the diagnosis and your plan. Section 3, breaking down the costs. Of course, knowing the process is only half the battle, right? Because the financial aspect is a massive barrier for so many adults. Now, what's really interesting about this slide is the sheer financial contrast. If you look at formal neuropsychological testing, which remember was the myth of what you had to do, you're looking at several hundred to a few $1,000s straight out of your pocket. That is a staggering hurdle. But because internal medicine doctors evaluate ADHD as part of routine care, a primary care evaluation usually just requires your normal office visit copay or coinsurance. That is a total paradigm shift in accessibility. And building on that affordability, ADHD evaluation through primary care is typically covered under most major insurance plans. For example, Elevate Health Group explicitly notes that they accept Medicare and PPO plans across all their locations. So not only are you avoiding the out-of-pocket gouging of specialized testing, but you're actually utilizing the medical insurance you already have. It is just far more financially accessible than most people assume when they first start Googling their symptoms. Section 4, your timeline to answers. When you're struggling to keep your life organized, waiting months for an answer just feels impossible. But the good news? You don't have to.
30 to 60 minutes, that is the length of your initial evaluation visit. It's incredibly efficient. You go in, you have a focused clinical interview, you go over your questionnaires, and within an hour, the ball is firmly rolling.
And here is how that timeline actually plays out in the real world. You can often schedule that first appointment within the exact same week you decide to call. From there, a final diagnosis and treatment plan are often finalized by your very next visit, so roughly 2 to 4 weeks from your first appointment. Think about that for a second. You don't have to put your life on hold for half a year. Within a month, you could have a definitive answer and a plan. And if that plan includes medication, there's typically a 4 to 8 week adjustment period, just to make sure everything is working perfectly for your unique biology. To give you a concrete idea of how geographically accessible this is, the source notes that Elevate Health Group offers this testing at their offices in Glendale, Burbank, and La Cañada, right in the Los Angeles area. And they specifically point out that all 3 of these locations offer those same-week appointments. So if you're in these areas, actionable professional help is literally just a few days away.
Section 5. Taking the next step.
So the crucial point is, what actually happens after a diagnosis? Well, a diagnosis isn't just a label. It's the key that unlocks a tailored, collaborative treatment plan. If your evaluation confirms ADHD, your provider isn't just going to send you on your way. They'll walk you through very specific treatment options. This might include stimulant medication or maybe non-stimulant medication if that better suits your medical history. It can involve behavioral coaching to help build better daily habits. Honestly, most often it's a combination of both, uniquely adjusted by your primary care provider to help you regain control of your focus. The source material provides direct contact info for those who are ready to act. Elevate Health Group, serving Glendale, Burbank, and La Cañada, can be reached at 818-246-8000, or you can just visit their website at elevatehealthgroup.com. It's always best to have the exact details right in front of you when you're ready to make that move. Which leaves us with this final thought. We've seen that you don't need a hard-to-find specialist, we've seen that standard insurance often covers the visits, and we've seen that you can literally have an appointment this week. So, if answers are this accessible, what's stopping you from taking the first step today? You have the structured roadmap now. The next move is entirely yours. Thanks for joining me for this explainer, and I really hope this provided the clarity you need to move forward.